Welcome back. It's this week as we take on a new topic in our continuing series here on YouTube, the LSS Holdings YouTube channel. This week we're going to discuss an indifferent different segment of the population that's using or looking for ways to not only make their workplace safer for themselves and their employees, but also for their customers or their clients. So we'll be talking about using UVC disinfection systems in medical and dental offices across the country. So again, LSS Holdings is a life safety company with 3 separate divisions with distinct identities that have been in business working through and providing life safety solutions. Hughes Environmental provides environmental facility cleaning, duct cleaning, ceiling and rafter cleaning, and combustible dust remediation. The LSS Life Safety Services Division provides fire and smoke damper inspection and repair, fire door inspections and repair, fire stopping, and UVC lighting solutions. And then SafeNetics, which just launched this month, is our safety e-learning certification platform, providing a virtual classroom for those seeking life safety certification. So again, we're going to be talking in this COVID-19 support series about what is UVC lighting. And it would seem that we have an unlimited amount of areas that we could use UVC lighting to help us with disinfection. And this is just another way or another application that we're seeing effective results using UVC lighting for disinfection. So this method uses short wavelength ultraviolet light to kill or inactivate microorganisms by destroying their nucleic acids and stripping their DNA, killing them, leaving them unable to perform the vital cellular functions and being able to regrow. UVC refers to ultraviolet light with wavelengths between 200 and 280 nanometers. And light in the UVC wavelength can be used for disinfecting hospitals, sterilizing surfaces, destroying harmful microorganisms in food products and in the air. And today we're going to be talking about them in the medical and dental areas. So how does this UVC lighting disinfection work? Well, UVC lighting is a simple and effective way to curb bacterial and viral growth. These specialized lamps produce an ultraviolet light that disrupts growth and inactivates existing growth, aiding in the disinfection of surfaces, water, and more. Using one in your facility can help improve everything from air quality to the health and well-being of you and your occupants. And by treating the air, in addition to using secondary treatments, in your air circulating, in your heating and cooling system, UVC lighting can kill mold and destroy airborne viruses and bacteria that ultimately lead to cold, flus, and other illnesses. And this can keep you and your employees healthy. And these technologies are science-backed and have the data to prove it. And we're seeing in these last weeks and seeing going forward, federal grants being issued for federal and state and local municipalities to be able to add these pieces of equipment to help them with their disinfection. So these are definitely proven. So why UVC lighting? Well, airborne infectious diseases are one of the most serious and visible health threats in the medical facilities. And in settings such as medical offices and dentist facilities, airborne pathogens can be spread by the air system, threatening the health of patrons and exposing facility owners to liability risks. UVC light disinfection reduces the risks of infection significantly. I personally have spoken to many dentists across the United States who have had to think of everything, including pens, at the reception desk. They themselves are right in the front lines, very closely with working with patients who come through their office every day. They not only care about those patients, they care about themselves and their employees. They also can't afford disruption or downtime in their workforce. If the dental hygienist isn't there due to illness, everybody suffers, not only the patients that need that care, but also the fact that they're not able to produce revenue or earn their own income as well. So it's a very unique situation. And the dentists that I've been speaking with and those on my team have been speaking with are grateful to be able to have control and be able to put that control into use in their offices and their practices, and they're very excited about using technology. One of the things I found about dentists is they are early adopters of new technologies, as are medical office buildings, and so that they understand the science behind it and really appreciate it. So UVC lighting is disinfection against COVID-19, but it's been around and has been attacking bacteria, viruses, mold, spores, and odor. They just haven't been a common use in these applications or setting that we're talking about. But going forward, they absolutely will be part of our daily lives, and we'll see them as we go through our day, and not just in hospitals and scientific settings. So using UVC lighting applications, there's been some innovations in equipment, and these are just some of them we're going to talk about. This is certainly not entirely every option that's out there, and there are a lot of customized options that we can discuss as well. But off the shelf, the Sterile Wand, we'll talk about that. Off the shelf, the mobile remote UVC system, and then customized, but certainly available for shipment, UVC Light for your HVAC systems, and then off the shelf ceiling wall mountable UVC systems, and then finally UVC Light disinfection for PTAC and fan coil units. So the Sterile Wand is the most relatable, most identifiable. It is portable. It definitely has a plug. It is not wireless, but it is for surface decontamination. It's portable handheld device that gives you the control without using chemicals. It is a green alternative, which will allow you to seek points for your LEED, either new building construction or EBOM, existing building operation maintenance, and your green credentials as well. It's a very thrifty method for cleaning and disinfection. It has a bulb that lasts for 9,000 hours, so you're going to get a lot of usage out of that bulb. The bulb is heavily protected so that you won't have to replace it from breakage, and it only weighs 5 pounds. So we're seeing customers using the Sterile Wand for the reception area. We're seeing the Sterile Wand being used for bathroom decontamination throughout the day, for the front office to be able to help and use that, maybe using during the lunch break, cleaning the waiting room. The Sterile Wand is going to be something that has very little training at all, very little issues. The picture that you see here, they're wearing a cotton glove, but there's a protective shield so that you can protect the user. And again, with any of these products, you would not be applying them to skin or to eyes. So that would be about the extent of understanding any kind of risk involved with using the Sterile Wand. So it gives someone a lot of flexibility. You can use it on demand as long as the area is cleared and you're not shining in anyone's eyes. So the Sterile Wand gives you a lot of control for very little money. So the remote mobile UVC system delivers the highest UV output, which would stand to reason, as you see with more bulbs, larger bulbs. It has a 360-degree disinfection power capability. It's portable, so you can plug it in where and when you need it. It has wheels. It's great for full room sanitizing, and it's app-enabled. So that means that whoever is positioning the machine can walk outside the room, use their phone, and turn it on. We're talking and selling this to folks that want to do midday cleaning and disinfection. In some cases, they're wanting to disinfect an area completely after an area has been used. But again, very easy training, giving you the safety and the control to be able to leave the room, use your phone, and disinfect that room in minutes. When we combine, when we want the greatest amount of disinfection, we discuss obviously cleaning the air. So UVC light systems for HVAC systems are fantastic. They have a 99.9% surface disinfection kill rate. They are ridding the coil of biofilm buildup, and they are improving HVAC efficiency and therefore providing an ROI over time, in many cases as little as 8 months. And they improve indoor air quality and reduce odor. So we can use our secondary systems for those high touch areas, And when we combine them with putting the UVC light systems in the coils, as we're seeing dentists doing, we have dentists across the country who are not only buying the wand and the mobile unit, but as well as putting the HVAC system in for that total cleaning and disinfection. And they're getting that additional bonus of reducing any odors and certainly that energy efficiency. The ceiling wall mounted UVC system is energy efficient. It's 9,000 hours of usage again with those bulbs, killing the same mold, bacteria, and virus. And it can be flush mounted or ceiling wall mounted into the wall. It can also have, using your electrician that you would have under contract, the ability to maybe have light switches for when you leave the room that it would turn on. But this gives you power. I'm hearing people using it in maybe the prep area or maybe in some of the high use areas where they're going to have the room down for a while. So somebody will be out of the room for 10, 20 minutes would be typical. And when they leave the room, the UVC light can be on and again, can be automatically timed into a switching feature. Really handy, somewhat portable. You can move them to another room. You wouldn't be moving them around during the workday, but you could move it if you were redesigning an office. So UVC light disinfection for PTAC and fan coil units. We do see PTAC units in lots of applications, especially hospitality and in long-term living and in apartment living, pardon me. But we can put bulbs in very efficiently and effectively in VAC electronic power supply with flexible mounting options available. They install in tight spaces. And as you can see in this photograph, there's very little room in between the grill and the actual equipment, but they have designed this equipment to be able to be adaptable. And they work off of your existing power supply. So again, we spoke a few weeks back about the Nebraska medicine study, the case study using UVGI to effectively inactivate wide range of human pathogens, including coronavirus and other human respiratory viruses. They were able to demonstrate that they inactivated the human respiratory viruses that we are fighting now, the COVID-19, on various models of N95 face masks. They were doing this to be able to reuse them, not to avoid having to buy any masks, but to be able to use them effectively more than one time, especially during the shortages. They found that the levels of UVGI needed to inactivate human respiratory viruses are well below the level of irradiation that adversely affects the fit and filtration characteristics of the N95 masks. So they didn't harm the masks and you were able to use them again. So UVGI can safely be administered when appropriate safeguards are in place. Recently, we've seen an increased request across the United States for respiratory hygiene stations. We have recently added this as well to our life safety lineup. And these respiratory hygiene stations prevent the spread of infection for your employees and your building visitors. So you can place these throughout your building. And they hold very comfortably 2 boxes of masks, 1 large box of tissues, or 2 half sizes per side, or a tissue mask and combo. These hygiene stations are also able to be equipped to be anti-theft. They give you the control to be able to share the infection control products that you'd like to share with your employees and your visitors, as well as be effective and be clearly designated at all times. So please remember to speak to us about respiratory hygiene stations when you talk to anyone on our teams. As always, you can contact us via our websites or via email. And then we still have available our 24-hour manned 800 number for any questions related to COVID-19 and how you can not only provide the education that you need for your staff and for yourself, but also to be able to receive the services and the products that you need to be safe daily. So thank you again. We ask that you subscribe to our weekly content, and we really appreciate the calls and the emails and the questions, and we hope that we can cross paths and help you to be safe every day out there. So thank you very much for your time, and we look forward to working with you.